Hi, Dr. G here. Today I want to pick up where I left off on the medical treatment of chronic pain. As I mentioned in the previous video, I recently attended a conference on a revolutionary paradigm shift for chronic pain treatment. I attended the conference to learn more about this treatment that I've actually been doing in my practice for about a year and a half. Now, the theory and its clinical application have been worked out by John Lithgow. Now, he's a physician practicing in New Zealand. So briefly, the story involves nerves in the body that are unmyelinated C fibers that normally don't transmit pain signals. Now, their job is to play a role in homeostasis. Homeostasis is maintenance of the body tissues. Now, these nerves are also termed sensocrine nerves, which means they send nerve impulses, and those are action potentials, but they also send chemical signals, and that's the crine part of sensocrine. Now, nerve impulse signals are how sensory nerves send impulses to your brain. And an example of that is when you hit your thumb with a hammer. Now, one difference with the C fibers is that they send impulses in both directions on the nerve. So the message is sent to the brain, and that message is pain, and then another message is sent the other direction, and that triggers chemical messages like the release of inflammatory cytokines and other molecules like substance P. Well, let me tell you, P stands for pain. Now, I'd like to look at it as two different kinds of pain. One that goes away, like when you hit your thumb with a hammer, and that's where those pain impulses are from sensory pain fibers called nociceptors. Chronic pain, and that's pain that doesn't go away, may be from the C fibers that don't normally send pain signals. It's theorized that these C fibers act as a backup system for trauma. They stimulate inflammation, which is part of the healing process, and they cause pain, which forces us to rest. The theory is that a blow, cut, burn, or a stretch to these fibers injure the nerve and it swells. This then causes an obstruction in the axonal flow in the nerve fibers themselves, especially where the nerve crosses through fascia or muscle canals. Now, this results in nerve damage, further inflammation, and activation of the capsaicin receptor that has now been renamed the TRPV1 or TRPV1 receptor. Now, because of the swelling, there's a strangulation of the nerve and it can't heal, and we develop chronic pain. Now, the good question is, why do pain doctors ignore this bit of neurophysiology? In fact, this entire topic is not even covered in medical school. Now, one reason might be that until they develop a safe drug that blocks the TRPV1 receptor, they're probably not going to hear about it. Now, clinical research usually goes unnoticed by doctors until the drug companies are there promoting a drug. There may be a drug very soon. There are thousands of studies on the TRPV1 receptor, and there's a great effort to find a safe drug blocker. Now, capsaicin blocks the receptor, but it also causes pain. Have you ever eaten a hot chili pepper or gotten one in your eyes? Now, eventually they will find a drug. But in the meantime, it's been noted that simple sugar injected near the nerve almost completely and immediately blocks this receptor, so you can turn off chronic pain and inflammation in a matter of seconds. The great thing about this treatment is that it also restores the normal axonal flow in the nerve, so that those nerve fibers heal and pain can be permanently cured. And not only is the pain cured, but the tissues that are inflamed that are beyond the nerve are also healed. The great thing about this as well is there's virtually no side effects. Sound too good to be true? As I say, I've been doing this in my practice for a year and a half, and I've had many pain-free patients because of it. Now, Dr. Lithgow in New Zealand has treated thousands of his patients over the past 8 years and has great results, and he's even published some of those results in peer-reviewed journals. Now, he's coined the name of the treatment as neural prolotherapy. Now, as the word spreads, there should be more physicians trained in this technique very soon. The website aaom.org may be able to direct you to a physician that's trained in this technique. This is Dr. G. Thanks so much for watching.